After receiving a cancer diagnosis, the 5 words you want to hear next are, "But we caught it early." Many cancers, when caught early, have survival rates above 90%. But even though the global cancer screening market is valued at $138 billion, traditional methods like X-rays or CAT scans and even genomic sequencing tests are still too imprecise, too expensive, and too slow, meaning far too many people don't receive a diagnosis until it's too late. At EpiOne, we have developed what we believe is a transformational cancer screening process that is as simple as a routine blood test taken at your annual physical. We believe it's faster, cheaper, and more accurate than nearly anything on the market. I'm Michael Marquardt, CEO of EpiOne. I have served on the board of directors of the American Cancer Society since 2018 and have been the chair of the board. I've been the CEO of 3 corporations and have served on the boards of several others. But after losing my first wife to cancer, shortly after my 30th birthday, I decided to dedicate my life to advancing cancer research and making cancer a less scary experience. About 2 years ago, I got a call from Dr. Sophia Fong, a PhD researcher who used to work at Memorial Sloan Kettering, one of the most renowned cancer centers in the world. When I picked up, she said the words that changed my life.
Michael, I found fragments on the genome that change when cells turn cancerous.
I was in disbelief. She couldn't have made this discovery on her own. But when she shared the data, I became a believer. In her very first test runs, her clinical results had an outstanding accuracy rate of over 90% in tissue biopsy and a very strong 70% in early patient blood samples, superior to anything currently in the market, with a simple PCR-based assay, similar to what we use for COVID tests. She started EpiOne to commercialize this technology. I've been immersed in the world of cancer research for decades, and I believe this is one of the greatest breakthroughs in our lifetimes.
I developed a technology for locating the exact elements altered on a cancer patient's genome that allows us to easily detect the cancer with high accuracy from a patient's blood or tissue samples.
On a financial level, the global economic cost of cancer from 2020 to 2050 is estimated to be over $25 trillion, or almost $900 billion per year on average. So the opportunity is huge. On a human level, the impact is even bigger. Cancer is the 2nd leading cause of death globally. With early detection, we believe we'll be able to save millions of lives every single year. When I tell people about EpiOne, the most common response is, "This is too good to be true." That's exactly what I thought. But we have the data. In fact, we've already been granted a patent for the detection of prostate cancer. We're ready to apply for additional patents on other cancers, including lung cancer, pancreatic cancer, and ovarian cancer, once we complete this fundraising round, with several more in the pipeline. This is a groundbreaking new company that we believe will change the lives of millions of people every year. And we want everyone to be a part of EpiOne. Become an investor in EpiOne today and help us transform cancer diagnosis around the world to save lives.